Hello, everyone. I thank everyone who's joining us from all over the world. So good morning, good afternoon, good evening. We have Dr. Aishwarya Kadu here with us. And so we welcome to the Global Summit, and we thank Dr. Kianar Shah for the opportunity of having us here talking about this very interesting and hot topic in dentistry, which is socket preservation techniques in implant therapy, and more than one way to fill the socket. We have wonderful Dr. Aishwarya Kadu. Welcome. Thanks for joining us. And I'm very impressed by her, as I think all of us following will be very eager to learn from her, as this young talent from India graduated and completed her BDS from the VYWS, I don't want to make mistakes, Dental College and Hospital in Mashra, India. She has several publications to her name, both nationally and internationally. She completed her MDS in oral and maxillofacial surgery, so super qualified, from the SDKS Dental College and Hospital in Mashra, India. And she's the course director and founder of Clinical Implant Excellence Academy in India. She recently won many awards. One of this is as Young Implantology of the Year 2020, conferred to her by Global Outreach Healthcare Award of 2020. And the list goes on with this award as New Practice of the Year 2020. So in the terrible years, she has an amazing year. So that's awesome to see, by Indian Professional Award of 2020. Her academy has also won a further award as Best Startup Dentistry by International Award of Excellence and AMP as Asia Dental Award of 2020 in London. And so she's been the guest speaker, so she has a lot of practice, and we can wait to hear her at World Virtual Dental Implant Expo 2020, and again at Chesa Academy in New Delhi in India. And she's also been a guest speaker for Denscope Academy, Mumbai in India. And so now we are very proud to have her with us at Global Summit, talking to us about the socket preservation techniques in implantology. So the stage is all yours. Tell us a little bit about yourself, doctor. So impressive.
Thank you so much. I'm so honored to be sharing a dad with you. And I'm so excited to share my knowledge regarding the socket preservation, which is most important. So let me share the screen first.
Please do. We're just covering a few minutes as Dr. shares her screen. Perfect. Technology is working. And please go ahead. Yes. Just go full screen and we're good to go.
Okay, so good evening, good morning to all of you who have been watching this. It's a privilege to share the knowledge with all of you. So I'm Dr. Aishwarya Kadu, and I did my MDS in the oral and maxillofacial surgery, and I'm also the associate professor of Swargya Dadasaheb Karmik Dental College in Nagpur, India. And I'm also the course director and the founder of Clinical Implant Excellence Academy. So let's get to the topic on the socket preservation techniques. What are the various techniques in implant therapy? And there are not just one way, there are various ways where we can fill the sockets. So what we are going to see is first is the atraumatic extraction. Second, now what are the various atraumatic extraction systems that we must know? Then the socket preservation techniques and the various graph for socket preservation, and the correlations of your graft and oxidative stress. So what do you understand by atraumatic extraction? Is the technique that is used to carefully remove the tooth and that dramatically reduce or eliminate the trauma of tissue preserving around the bone. So what are the advantages of atraumatic extraction? What the first it does is preserve the tissue and the bone around the teeth, It improves the potential of the body to regenerate the bone and fill in the socket. It reduces the risk of infection, reduces or eliminates the discomfort after the extraction, and preserves the natural contour of the gum and enhance the aesthetic of the final restoration. So before going for an extraction, one and most important thing, the periosteum. So why it is so important? The periosteum contains some multipotent mesenchymal progenitor cells, and these progenitor cells play the key role in the bone graft, hemostasis, and the repair. So biomechanic behind undergoing the traumatic extraction. A traumatic approach employs gentle and circumferential rotations for 30 seconds. It stretches your pedal ligaments and it releases your lysosomal enzymes and bleeding in the pedal space. And this initiates your hydraulic pressure in the ligament and this further loosens your tooth. So what are the various instruments that we can go ahead with a traumatic extraction? The most common is that we must have is the scalpel blade, periotomes, power tomes, and the physics forceps. There are also certain systems that now we are getting available. As the easy extract system, Benex extractor, sapien extraction kit, neodent extractor, and cover medi extraction kit. So now why the alveolar bone preservation post extraction is so important. You know that the alveolar bone process is usually the tooth dependent tissue and its architecture is related to its eruption axis and the eventual inclination of the teeth. So the resorption and the remodeling of the alveolar ridge after the tooth removal is a natural process, but is inevitably and negatively impact your implant placement. So as you all know, what are the biology of bone loss after extraction? So once you do an extraction, the clot formation gets and the RBC and WBC forms clot formation. And that clot is replaced by the granulation tissue within the 4 to 5 days, and then it replaced by the connective tissue within the 14 to 16-day period. And then you will see the calcification of the osteoid. And after that, the socket is totally closed. So as per some research studies, it is said that the loss of alveolar bone is usually more in the horizontal dimension than the vertical dimension. Approximately 5 to 7 mm of horizontal buccolingual ridge reduction can occur in 6 to 12 month period. When 2/3 of the bone volume loss usually occur within the first 3 months, and chances are more in the molar region. So now we are going to see about the various instruments which we must have. The first most important is the periotome. So you will get these 2 types of periotome, is the straight and the angle one. So the straight you can go ahead with the single rooted, and the angle you can go with the multi-rooted. Then the next is the another one which is called as a power tome, which is the motorized. You will get such a type of machine you get available in the market, and this is the perotome which is usually vibrate inside. So I'll just show you the short demonstration actually, which you can get to see it. What is this power tome actually?
This video demonstrates the use of a new device to aid in atraumatic extraction of teeth to facilitate later implant placement. The video is produced by the Arthur A. Degoni School of Dentistry at the University of the Pacific in San Francisco. The surgery is performed by Dr. Len Tolstanov. The device is called a power tome and is produced by Westport Medical. The easiest way to describe the instrument is that it is a micro jackhammer used to expand the bone gently around the tooth to facilitate removal with minimal damage to the bone so that the site is ready for implant placement later on. The tip of the device is inserted into the PDL space and gentle pressure is exerted. The hammering will introduce the tip into the PDL and expand the bone.
So this is how the power tome works. So it is usually motorized and it vibrates inside once you keep in the pedal space. And once it vibrates, as you all know, the pedal space stretches and this may loosens your tooth. So the next is the physics forceps. This is not a common forceps. This is physics forceps. You will see one peak, which is based on the first class of liver mechanics, where the one peak has a bumper place, and this helps, which is kept below the tooth, and it helps you to act as the lever, and it helps you to luxate your tooth from the socket. So this is a short demonstration. So how that bumper act and how you can remove your tooth using the physics forceps. So here the physics forceps doesn't stretch, it doesn't compress your bone, and it doesn't cause anything. So that is why bumper is very important, and this is the mainstream of the physics forceps. So the next important system, which is most common nowadays, and that is called as the Benex control system. It is actually controlled one, and it is safe for removing your dental root or dental root fragments. So it is very innovatively constructed, and it is based on the pulley mechanism. So just short video, I will show you how it is done. So here actually they just drill within the root, and then they put the Benex extractor to pull it out from the socket. So this is an adapter usually, and it adapt and be on the adjacent tooth, and then it helps to act as a pulley and stretch your tooth from the socket. So this is how you can remove using Benex extractor automatically. So now coming to why socket preservation, why it is so important. It avoids and compensates resorption of biological socket wall. It reduces need for further bone augmentation. It increases implant survival. It reduces marginal bone loss and increase bone formation. So now, what are the various socket preservation techniques? It can be open or it can be closed. So why open? It is used in the case when there is an extensive buccal wall defect, and the closed when you're having an intact wall. So socket preservation technique. It can be cola plug technique, it can be ice cream cone technique, bicol technique, socket grafting using various grafting material. So this cola plug is commonly used technique where you'll be using long back. So what is it? It's a collagen plug which you place inside the socket, and then the next technique is important is the ice cream cone technique. So it is first introduced by Dennis Turner, and it is the most wonderful technique that I have also associated with. So this is short case report where you can see how the ice cream cone technique is done. This is a healthy patient which reported with a failed root canal treatment, and he has the history of wearing the ceramic crown with that, and there was no past any dental history of trauma or any medical history. So this is the pre-operative view. So this is it OPG, and you can see the root canal treatment which was done with 11. So now coming to the ice cream cone technique and how it is done. First, here in this case for atraumatic extraction, I have used my perotome, and with this I facilitate atraumatic extraction. Then the extraction was done, but as you can see in an X-ray, there was a lot of perforation, and patient reported with the RCT was done with the perforation. So it was done very meticulously and step by step to remove the tooth. So as there was a perforation, there was a lot of tooth was extraction very precisely, but with the fragment. So this is how my extraction socket is. Then I place my collagen membrane and I cut it with this ice cream cone shape. I cut my membrane with this ice cream cone and place it in the socket. Then the socket was grafted with the minor-os horizontal axis xenograft material, which is porcine. Well, we are also going to discuss regarding the graft. And then I suture it down using crisscross suture. So this is 4th post-operative day. You can see the 4th week healing and after 1 month of healing. So patient reported me after 6 months, and then I went with the CBCT. So I was getting the height of 13 mm and 7 mm width. So I digitally planned the case using surgical guide, and I placed the surgical guide. This is my surgical guide, which is wonderfully done by Kadu Dental Lab. And I underwent with the Biohorizon TRX implant placed using the surgical guide. This is my post-operative IOP radiograph. And this is my provisional process, which is given. So you can see the difference between the initial situation and the final situation. So what can be the treatment tragedies that we can discuss? So what can be the goal? The ultimate goal is to prevent as much as the alveolar ridge as possible and prevent the resorption of the buccal plate in particular. Biomaterial can prevent your resorption to some extent. So now we will go with atraumatic extraction, and then I will go with my socket grafting, and then I will plan with my implant therapy. So when you're putting the grafting material, it needs at least 6 to 9 months to allow for the enough graft placement and the new bone formation, and wait for 4 to 12 weeks for an implant placement. So now coming to the guided bone regeneration. So you can underwent with the guided bone regeneration with and without necessarily using grafting material. You can go with the grafting using the bone substitute. You can use the osteogenic material, which can include the autogenous bone marrow and the plasma rich in the growth factor. And you can go with other materials which are available. So now coming to the oxidative stress. What do you really understand by oxidative stress? See, whenever there is an injury, inflammation happens and there is a formation of oxidant and antioxidant. Both the balance, when there is a balance between the oxidant and the antioxidant, you don't get any stress. But when there is an imbalance between the antioxidant and the oxidant, then it may lead to oxidative stress. And this in turn leads to the failure of remodeling. So oxidant usually has a devastating effect on the bone. It causes inhibition of your osteoblastic activity. It promotes osteoclastogenesis. So what can lead to the oxidative stress? Tension on bone or tension in the soft tissue. If you give the tension, if you underwent with a traumatic bone extraction, it can lead to the tension. Or if you go with the soft tissue extraction, it will lead to the tension. So this in turn leads to the oxidative stress, and this may cause the bone resorption, or there can be the poor bone healing. So now coming to the which is the most perfect bone grafting material. As we all know, then autogenous is the gold standard, but ultimately it's inconvenient because it's caused the systemic bone loss. Then we can move towards allograft, but as per some research, there still has some amount of bone loss. Then we move towards xenograft. As we all know, it is a slow repairable material. So we can get the xenograft in two types, bovine and the porcine. Now coming to which is more important, bovine or porcine. So bovine and the porcine, I will prefer porcine more, because when you are preferring the grafting material, there should be 3 properties that you should check. First is the microporosity and the macroporosity. Second is your volume stability. And third is your resorption rate. So when it comes to microporosity and the macroporosity, what do you understand by micro and the macroporosity? You will get that spaces in between the granules. That spaces is very important. Your bone regenerate in that spaces inside the microporosity. So when you have a sufficient microporosity, your bone regenerate within it, and it helps to initiate your angiogenesis. So when it comes to porcine, it is similar to your human bone, but bovine doesn't resemble to your human bone. So first comes the porcine and then comes last the bovine. Second, comes to the volume stability. What do you understand by volume stability? When you hit any graft, it should increase the swellness and it should maintain the volume stability. So this volume stability is very important. So porcine, when you hit it, it gives you amazing volume stability than bovine. So as per xenograft, porcine is the best material because it has the perfect antigenic property, which is similar to human. Second, it has the microporosity and the macroporosity, which is similar to the human. Then it has an amazing volume stability. So porcine is the best xenograft. Even you can go with the autogenous, but graft should be selected as per your cases, whether I need the autogenous or whether I go with the allograft or whether I go with the combination of both allograft and the xenograft. So this is what the socket preservation is. So when you take the small step in the right direction, can turn out to be the biggest step of your life. So please take your cases, systematically plan it, and go ahead with the socket preservation, which always saves you whenever you're planning your case for the implant therapy. So thank you.
All right, there we go. Thank you, Doctor. And amazing presentation. And of course, this is the future. This is what we would like all doctors to become trained and do, to know how important it is to preserve the socket prior to implant placement. And you have mastered this technique. And you can confirm to us that it's actually much easier said than done, right? It looks a little complicated, and of course it takes experience and it takes the right tools, but definitely the results are amazing for our patients. What are your thoughts on that? How did you become interested in this technique? Can you share us your experience in how you got to be so efficient at it? What was your path?
Share my screen. Hello.
Sure.
Okay.
Yes, I don't know if you hear me. Can you hear me?
Yeah, I can hear it.
Right. I was asking you to share with whoever's watching us or our colleagues, what should be the first steps to get acquainted with this technique? What are your recommendations? How to approach it to become efficient like you?
Well, when you are seeing any case, when one case comes to you, there are various techniques that I have shown. You can go with the collagen plug, you can go with the ice cream cone technique, or you can go with other, simply grafting the socket. But when you're selecting your case, your patient criteria is more important. Second, what is the condition of your tooth? Whether you can go with the atraumatic way. Atraumatic way is always important. But whether it is possible for you to go with the atraumatic way. If it's not possible, then you can have to think which you can go with the peritome, you can go with the other techniques that I have shown you. And after that, after seeing the condition of the tooth, then comes and think whether which techniques we can think about, and then select it, and then you plan about the implant therapy.
Do you offer any courses at your clinic for other doctors who are willing to travel and come and meet you to teach this technique? Do you have that in plan in the future now?
Yeah, I'm offering the courses in my academy. I'm taking the courses on the basic courses and advanced one.
That's wonderful. So please follow Dr. Aishwarya Kadu, follow her social media to see the announcements of these courses and go learn from her, learn from the best, and start enjoying socket preservation in your implantology. And you will see that the results, the long-term results, the prognosis of your implants will be much more secure and predictable, right? Is that what you can confirm for us? And the long-term satisfaction of your patients is definitely a guarantee. I personally love these techniques, and I have seen a tremendous change, and I'm not as qualified as you. I'm a general dentist. So this is an encouragement for the general dentist, even if he cooperates with a licensed maxillofacial surgeon to place his implant. It starts at the extraction moment. Maybe you decide to extract a tooth and later refer or have the maxillofacial surgeon come to your clinic and place the implants. There's this cooperation very often in every office. But the beginning moment is when you extract the tooth, and any general dentist can learn and become very good at preparing the scenario for the perfect implant placement. We need to be very aware of the risk of implantitis, the risk of failure, and this risk is minimized, or we show that we do the best that we can to provide the best care to our patients, right? It would be a very useful collaboration if the general dentist starts preparing the work for you instead of leaving disaster and resorption and many surgeries that then you have to do, right? We could all...
That was constantly because when I'm an oral surgeon. So when I was used to do an extraction and people used to get a lot of traumatic way. So it hurt me, and then I thought, why socket preservation is the best way. So when I started doing the socket preservation, there are a lot of changes where when I see and I graft a socket, that changes basically helps us in the future.
Yes. So this is our desire that many colleagues got interested and saw the benefits of this technique and start being curious and asking their surgeons to perform it or to work hand to hand close by to ultimately the best interest of the patient. It's very rewarding, less morbidity, so less problems after work if you do all the steps correctly. And also, ultimately, this is what Global Summit purpose is to do, to enable and empower all type of medical professionals to interact together, to learn from each other, to grow. You're never done learning with medicine, right? And I hope that this lecture was very interesting for you, as it was for me. You can comment down below in the Facebook Live your questions, and Dr. Kadu or myself will try to answer as we are able. In the meantime, we thank you for joining Global Summit. We thank Dr. Kiran Shah for providing this amazing platform and for putting together so many talents and young doctors who can share with us their experience. In the meantime, have a wonderful Saturday, and see you next time for the next webinar. Thank you.
Thank you.